Many people come and ask me, Doctor, I get severe headaches. Do you think I have a brain tumor? Yes, this anxiety or this phobia can be real. A lot of people out there having headaches suffer with anxiety issues that they are having or going to get a brain tumor. Let us break down the symptoms of brain tumor and also understand how to differentiate this from a common type of headache, that is migraine headaches. Hi, my name is Dr. Raveesh Sunkara. I'm a neurosurgeon practicing at Arete Hospitals, Hyderabad. Let's talk about a topic: how to differentiate a headache, that is migraine, versus headaches that come in brain tumors. All of us have headaches at least once in our lifetime. You would be surprised that 70 to 80% of the population actually has headaches quite often, and this is a worldwide statistics. So, some of us obviously fear that when we are having such regular headaches, do we have some kind of a serious issue like brain tumor? Let me break down some simple things that you need to note to understand whether it is some serious problem or a regular headache. Let us start with some basic facts. Headaches are the most common things, especially migraines are so common that almost 1 in 7 population in the entire world suffers from migraines. But brain tumors, on the other hand, are extremely rare when compared to this statistics. Yes, brain tumors sometimes are associated with headaches. But like I said, this statistics, you need to understand that very few people who are having headaches have actually brain tumors. Migraine headaches have a few common symptoms or few common presentations. They are usually persistent over a long period of time, like years or months. They are usually one-sided and have a throbbing sensation. They might be associated with symptoms like nausea, vomiting, or the feeling of sensation that you would puke. Some patients having migraines experience a symptom called aura, or some kind of visual disturbances or auditory disturbances prior to having such episode of a headache. You need to understand that these kind of migraines are usually subsided after 24 to 48 hours completely. Now let's talk about the kind of headaches or the symptoms of a headache that you should be really worried about. And these symptoms or these type of headaches tend to be associated with some serious problems like a brain tumor. These headaches usually happen in a person who's never had such episodes of recurrent headaches in the past. Second thing is, these headaches are usually persistent and increasing over time with intensity and the duration of the time the person is having headaches. The person might wake up with a headache. In the early morning, they might wake up with a headache. And these people usually also have the associated symptom of headache with vomiting. But unlike migraine, these patients usually the headache doesn't reduce even after the bout of vomiting. Sometimes these type of headaches are also associated with other symptoms such as having blurring of vision or double vision, having memory issues, having some other neurological problems like gait imbalances or weakness of a hand or a leg, or sometimes they are associated with serious problems like seizures or fits. Let us understand why brain tumors cause headaches. You would be surprised with the fact that our brain actually cannot feel pain. But when a tumor starts growing in the brain, it stretches some structures in the brain like the meninges, that is the covering of the brain, which is actually pain sensitive. Also, these brain tumors might stretch the blood vessels or the nerves that are there inside the brain, causing such headaches. Sometimes these brain tumors block something called a CSF pathway or the pathway in which the brain fluid functions, and causing this blockage might lead to CSF accumulation, causing raised pressure, thus causing headache. Such pressure, especially while laying flat, increases even further. That is the reason in most of the brain tumor patients we see very early morning headaches, because they have been lying flat all through the night. So when should you consult a doctor when you have such a headache? Please understand that if you have never had such headaches in the past and suddenly started having headaches, especially in the adult, especially if you are like above 40. If these headaches are associated with any of the neurological symptoms that I explained earlier. To summarize, please understand that most of the headaches are not headaches due to a brain tumor, but actually a problem that is related to migraines or tension headache or some stress issues. Headaches related to brain tumors come with some specific symptoms and also associated symptoms. Please understand them very deeply. Please never over medicate or self medicate for a very long time for such headaches. Do consult expert opinions or doctors if such headaches are persistent or increasing over a period of time. Also, do understand that the most important thing when it comes to brain tumors is early detection and prompt treatment. So, understanding and not neglecting any of the brain tumor symptoms is equally important. Do consult a doctor when you have some problems or anxiety issues because of such headaches. If you found this video helpful, do share it to your loved ones or someone you think will benefit from watching these videos. Please do subscribe to our channel if you like such videos and want to see more.